Camera ready, we would be happy to have you on. And if you're feeling a little camera shy, that's okay too. We're just looking forward to everyone's participation today. So thank you again, Margaret, for that. Before we dive deeper into our own goals and objectives for the CHIP, we are excited to have some wonderful guest presenters with us today from the local Behavioral Health Authority. They'll be sharing some highlights from their strategic plan and gathering some feedback from us. So if you all can join me in giving a warm virtual welcome to Amani Booker-Lewis, manager of the LBHA, Cherie Smith, Public Health Program Chief, and our very own data expert, Deborah Collier, Senior Epi from the Health Department. Thank you all for being here and sharing with us today. And again, just let me know when you'd like me to advance the slides, okay?
Thank you, Shanae, and good afternoon, everyone. Thank you so much for this invitation. Again, my name is Imani Booker-Lewis. I'm the manager for the LBHA with the Prince George's County Health Department. And of course, I would like to extend a big, great thank you to Shanae Vicks and the Healthy Mind Workgroup co-chairs for the opportunity to be here to share the LBHA's new 3-year strategic plan covering fiscal years 2027 and 2029. Also joining me, as Shanae mentioned, is Cherie Smith, LBHA Public Health Program Chief, and Ms. Deborah Collier, Senior Epidemiologist with the Health Department's Office of Assessment and Planning. And so today we're going to be discussing the importance of aligning our strategic plan efforts with the voices and needs of the communities that we serve, Prince George's County. As we walk through this, I invite you to think about the LBHA's role in shaping a more responsive and equitable behavioral health system in the county. So I appreciate all of your attention, and we can go ahead and advance the slides. Thanks, Shanae. Okay. So today's presentation, we're going to talk first about the meeting purpose. We're going to begin by reviewing the priority goals and objectives that guide our work and outline the key areas of focus for the coming year. We will discuss the strategies for implementation, including how we plan to operationalize these goals and ensure that they are effectively carried out. Next, we will also present data that supports these priorities, highlighting the needs we are addressing. And then finally, we will use this time to gather feedback and recommendations from the Healthy Minds Workgroup, as your input is extremely critical to strengthening the plan and ensuring that it reflects the community's needs and perspectives. Next slide, Shanae. So just a little bit about the LBHA. If you don't already know, the LBHA is also known as the Local Behavioral Health Authority, is a state-mandated entity with several key responsibilities. First, the LBHA is responsible for planning, managing, and monitoring the accessibility and quality of behavioral health services across the county, ensuring that residents receive effective and appropriate care. Additionally, the LBHA serves as a central point of contact for residents, helping individuals and families access information, connect to services, and receive support for mental health, substance use, and other related disorders. And finally, the LBHA plays an important role in monitoring grant-funded behavioral health services, particularly those that are not reimbursable through Medicaid, to ensure effective use of resources. So together, these functions position the LBHA as a critical leader in coordinating and strengthening the county's behavioral health system. Next slide. Okay. So our strategic planning requirements. As a state-mandated entity, we have statutory requirements that we must abide by. And so here, this slide highlights the statutory requirements that guide our work under the Maryland Health General Article sections 10-1201 and 10-1203. Under this requirement, LBHAs are required to develop a strategic plan that serve several key functions. First, these plans must address the needs of priority populations, ensuring that services are targeted toward individuals and communities with the greatest need. They also guide behavioral health system planning and coordination, helping to align services, providers, resources across the county. In addition, the plans are required to align with state behavioral health priorities, ensuring consistency with broader goals set by the Maryland Department of Health. And so we've linked both the statutory requirements and the state's behavioral health plan here in these slides, so you should have access to that as well. Next slide. And so a part of our strategic planning requirements also include our local advisory groups. Local advisory groups must review the strategic plan to ensure that the plan reflects real community needs. Advisory groups like the Healthy Minds Workgroup often include consumers, providers, and advocates. And so your input helps to ensure that our strategic plan aligns with behavioral health challenges, service gaps, and cultural considerations that we must take into account for Prince George's County. And so you'll see here, there are two advisory groups, the local mental health advisory council, as well as the local drug and alcohol abuse council. Those are two advisory groups that would typically advise the LBHA on the strategic plan. Currently, those two advisory groups are disbanded, and we're working to reestablish those groups. So we're currently in the planning phases, trying to restructure and figure out and develop this core group that would continue to advise the LBHA. But the Healthy Minds Work Group is definitely an advisory group that's been approved by the state to help advise us going forward for this strategic plan. And so with that, I'm going to hand it over to Cherie Smith, our LBHA Public Behavioral Health Chief, to talk more about this.
All right, thank you, Imani. Good afternoon again. As you've heard, my name is Cherie Smith. I'm a Public Health Program Chief with the local Behavioral Health Authority. And if you go to the next slide, Shanae, I'll talk to you all a little bit more about the role of the Healthy Minds Work Group in our strategic planning work. Now, the Healthy Minds Work Group has an important role as a part of the Prince George's Health Action Coalition in shaping and strengthening the strategic plan. The work group is being asked to review the proposed strategic plan, strategic goals, and objectives. You will also help assess how well these goals align with the current needs of the community and bring your expertise and perspective to the local planning efforts. In addition, we are looking to you to recommend improvements that can strengthen the plan. As you review the materials, we encourage you to keep a few key questions in mind. Are there gaps in services that we should be addressing? And are there additional strategies that the LBHA should consider to better meet the community needs? We want you to know that your input is critical to ensuring this plan is both comprehensive and responsive to the populations that we serve. Next slide. The plan addresses several areas, and this slide includes a few that we pulled out for the purposes of the presentation today. Over the next 3 years, we want to make behavioral health services easier to access, strengthen supports for individuals with substance use disorders, and expand crisis response and diversion services. We'll also work on better coordination across the behavioral health systems and make sure we're addressing health disparities and supporting our priority populations. Next slide. Now, we also included in our planning efforts, we identified a few barriers. Most of us are familiar with the social determinants of health, such as poverty, food insecurity, affordable housing, financial instability, and transportation, which we all have heard at one time or another being expressed as a barrier to accessing healthcare. Well, in Prince George's County, we acknowledged that there were several key challenges that our residents faced as we completed our planning efforts. First, staffing and workforce capacity remain a major concern. Even with the recent LBHA restructuring that we did, we hired additional team members and monitors. We received additional resources from the county to expand our staffing capacity. We are stretched thin, and I say that lightly. And so, as a part of our goal, our strategic plan is to increase that staffing capacity so that we can better meet the needs of our community and our requirements within our statutory requirements that Amani referred to earlier. Also, there's some workforce shortages that we all have become familiar with. We've heard a few times that programs struggle to hire and retain qualified clinicians. We've heard the need for additional peer staff amongst all of our behavioral health continuum, and then other specialized behavioral health roles. So we want to address the workforce shortages. There's also a growing need to support older adults, particularly in assisted living, which we are planning to hire a dedicated care coordinator for that. So our plan addresses some of those needs. And most of our providers, when reading their annual reports, express the needs to improve the behavioral health supports for older adult population. So that was the area we wanted to include. And then community awareness of behavioral health resources like 988, mobile crisis services. They're still pretty, the knowledge of them is still pretty limited amongst our community. So we want to increase our outreach efforts through schools, faith-based organization, health fairs, and other community events so that we can increase access and reduce stigma. And then finally, housing remains a major barrier for many of the populations, including justice-involved individuals, older adults, and women with children. Limited, affordable, and supportive housing affects discharge planning, engagement, long-term stability. While programs have kind of adapted to not having as many housing resources in Prince George's County, we are still invested in ensuring that there's system level support. So that's essential to strengthening our behavioral health continuum and ensuring equitable access for all of the residents. Thank you, Shanae. And right now, I'll turn it back over to Amani to discuss our goals, objectives, and strategies.
Thank you, Sharice. So we've identified 3 key goals that the LBHA would like to focus on. And so I'm going to start with goal number 1, which is to ensure that there are quality behavioral health services and resources to respond to local priorities. This goal directly aligns with the state's priorities. All of our goals do, to be, just to communicate that. And so under this goal, we have 3 objectives. Our first objective, as Sharice mentioned, is to increase staff capacity within the LBHA to manage an increase in workload that we've seen over time across the behavioral health landscape to ensure that we can achieve our goals and be effective in the community. So what we would like to do first is to complete a workforce assessment. A workforce assessment is one of those basic practical tools that you would use to ascertain, where are the gaps, where do the gaps lie, how many individuals do you need to handle a particular work function. And so that's where we want to begin in FY27 is with a complete overview of our workforce internally. And then in Q4, we want to implement the implementation of 2 solutions to address those key workforce needs that are a result of this workforce assessment. And so you'll see under the performance metrics is 1, to complete the assessment, and then 2, to identify the number of solutions that will be implemented to address any workforce shortages. And so we have baseline, and then we also have the targets, which is 1 assessment completed by FY27, and then at least 2 solutions identified that we can address as a result of that workforce assessment. And then in objective 2, is to identify and share resources for our limited English speaking population. What we know is that year over year, we see that many of our diverse and populations continue to grow and expand. We often receive requests to translate documents and also to ensure that we are intentional about having translated documents and that we have resources to share with those who may speak another language other than English. And so the outcomes for that would be to increase availability of resources for all county residents. And our milestones would be to have an updated resource list that we would update quarterly, and then also have a resource list that we would share with providers on a biannual basis. And so if you look further down the road there towards our targets, we would like to have four in FY28, four updated lists, resource lists identified. And this is to ensure that we have resources that we can share with the public. For example, if there is an individual that is seeking a provider that has therapists that speak Spanish, and Spanish is their primary language, we want to ensure that we have a list, a curated list of providers who offer that particular service. And so we have to be intentional on a regular basis to make sure that we are going through our resource list, checking with our providers to share updates, because updates happen often and frequent. Providers reach out often to say, hey, we have this new service, or we just recently onboarded a therapist whose primary language is Spanish and can be able to, work with clients who have limited English speaking capacity, or, speak their primary language is Spanish. And so with that, we want to make sure that we have resources available to connect those individuals to. And so objective 3, you will see we are intentional about increasing evidence-based programs, improving the quality of behavioral health, to ensure that we're improving the quality of behavioral health services. And so what we know is that from our CHA, from the community health assessment, key informants identified mental health and behavioral health as the top priority affecting Prince George's County residents, followed by chronic disease, access to care, food insecurity. And so for this particular objective, EBPs we know are important because they ensure that services that we're investing in are proven to work, and that they're backed by research and have real world results. And so what we want to ensure is that behavioral health providers have access to EBPs, the training, the guidance, the technical assistance. And so in Q4 of FY27, we're identifying what are the current evidence-based programs that are available across the county, and taking account of that by the number of evidence-based programs. And then based on the number of programs identified, we want to work to increase that number of EBPs available in the county by 25%. And then in Q4 FY29, we want to identify and share assistance and training and resources that, again, will help to impact that. We want to ensure that the number of crisis providers utilizing evidence-based programs is increased. And our goal for FY27 is to increase that by 10%. And then I will turn it over to Sharice for the next slide.
All right, thank you, Imani. So I know we're a little tight on the time, so I'm going to go through this slide a little quickly, but you all have access to this, and we will ensure that you have it again after the presentation today. Okay, so goal 2, we all familiar with the community health assessment, and that identified the availability and accessibility of behavioral health providers remain the leading barrier to accessing behavioral health services. The community also lacks awareness and experience with navigating behavioral health services in Prince George's County and not fully knowing how or where the access points are. And so the community input also included the community health assessment also included that the lack of access and awareness to these services did not allow us to promote mental health seeking behaviors before the point of crisis. So with that said, our goal two is all about improving provider and consumer awareness of available services and how to access them. And so we have four objectives, and the objective 2.1 is to increase the LBHA website traffic. 2.2 is well, I'll stay with 2.1 for a moment there. This is about increasing the website traffic, increasing improving the structure of our website so that it is useful, user-friendly to the public, that our provider information and provider is included in the website, and that our providers also will find it useful with all of their resources and information. So we have a target to increase to 25% of the traffic quarterly by FY28. Objective 2.2 is regular bi-monthly all provider meetings. So we should host, and we do host, bi-monthly provider meetings for all of our providers in our public behavioral health system network, as well as our grant-funded provider network. And so we want to increase engagement. So we're going to plan a series of satisfaction surveys and implement the findings. We'll also the percent of providers rating positive satisfaction on a Likert scale is how we will measure that. And then we will have a target of 75% satisfaction ratings achieved by Q1 in FY29. And our provider meetings are full of presentations on relevant topics and information. We share updates in the behavioral health world with our providers. Any grant information we share, any county-related relevant information we share, but we want to make sure that the providers find the information that we have been sharing useful. And then objective 2.3 is to design and deliver multilingual, culturally competent resource awareness campaign using social media, culminating in the annual Behavioral Health Expo. So we're going to increase the accessibility of behavioral health resources for all residents, increase awareness of resources. And then the milestones, we're going to develop a social media campaign, and we'll host an annual behavioral health expo. And by the way, this is a plug. Help me with the date, Monty. The Adult Behavioral Health Expo,
May
our
16th,
third year is May
Saturday.
16th. Thank you. I didn't want to get that wrong. I know that we'll be sharing that information widely with you all as well. And then the performance metric is the number of residents reached by the campaign annually, and we're targeting 25,000 residents by FY28. And then our last objective is to develop a partner outreach strategy focused on older adult population that identifies behavioral health resources, reduces suicide risk, and reduces mental health stigma, bridging the gap between behavioral health and somatic care. So you kind of see how some of those challenges that we've been discussing is tying into our goals and objectives. And that's what we kind of want you to pay attention to. What are our needs in the community? How do they tie into our goals and objectives? Are we missing anything? And then just quickly, our outcome is to improve mental health among county older adults. And our target is to be determined. So it's based on the number of provider and caregivers and assisted living facilities identified. So we'll develop an outreach strategy to do some work around our older adult population and identifying some behavioral health resources for them. Thank you.
Thank you, Sharice. And you can go to the next slide, Shanae, and I'll be really quick. I know Deborah has some extensive data metrics that she wants to tie into our goals here. And when I have an opportunity, I'll drop the Spring into Wellness Expo that's coming up in May for Mental Health Awareness Month. I will drop that in the chat for everyone's awareness. And so for goal 3, even though I'm moving through this quickly, definitely this is an important point to highlight. Our goal is to improve the quality and quantity of behavioral health services targeting children and youth. We want to ensure that we have, of course, quality behavioral health services for all across the lifespan. But what we do know is that in our county that um, we there is a need for acute behavioral health services for our young people. And so, what we're working on is first to assess the current needs of the youth population and use this data-driven assessment to form our approach. And so, through that assessment, which we hope to have one at least by FY28, that will help to lead and guide us as far as the additional behavioral health needs, services, resources that are needed for our young people. And so in Objective 2, you'll see based on the result of the youth assessment, we will implement solutions to expand services targeting that population, children, adolescents, and transitional age youth. Effective utilization of resources to best meet youth behavioral health needs would be the outcome. And then the milestones would be to utilize the assessment to identify the biggest needs and creation of 2 new evidence-based programs to support the area of need. And 2 new programs would be identified and implemented in Q4 of FY29. And then under Objective 3.3, we have to increase the number of program monitors assigned to the Compliance and Service Coordination Unit within the LBHA to improve oversight of public behavioral health services programs. As the number of providers continues to increase, we definitely have to make sure that our internal infrastructure aligns with that increase. And so the outcome will be the improved ability to monitor the programs. And through monitoring, we're talking, the full monitoring process, which includes site visits, which includes technical assistance. And then we know for any new program that comes to the county, there is a more enhanced approach to technical assistance that we offer to ensure that that provider is successful in getting up and running. And then in Q4 of FY28, we work to hire the additional monitors to support the number of programs that are coming on board. And so the goal is to have 8 program monitors hired by Q1 of FY29. And under Objective 3.4, we would work to support the Suicide Awareness and Prevention Coalition, SBAC, in creation of a comprehensive suicide prevention plan for the county. If you are part of the SBAC coalition, then you know that our youth and young adults are one of our priority populations for the prevention of suicides to ensure that there are and our vision is to ensure that there are 0 suicides in the county. And so through increased partner engagement, we plan to have a reduction in the suicide rate among our young people. And in Q1 of FY27, utilizing the SBAC, we will incorporate this into the suicide plan and have that plan completed by FY28 of Q1. And with that, I will turn it over to Deborah Collier to talk about how the data supports our goals, strategies, and objectives.
And I know we're short on time, so I will go through these few slides pretty quickly. So the data portion of the strategic plan kind of demonstrates that the data that's kind of utilized to support the need for the developed goals and objectives. And you can go to the next slide. So the first goal to ensure quality behavioral services and resources are available to respond to local priorities. So the objectives outlined previously are aligned with priorities determined by the Community Health Assessment, 2025 Community Health Assessment. So specifically considering the input from the community, key informants identified mental and behavioral health as the top priority affecting Prince George's County residents, followed by chronic disease, access to care, and food insecurity. And 1 in 4 residents identified mental health as a key issue, resulting in it being ranked as a 7th leading priority. Nearly 16% of residents also identify substance use as a priority issue. And so the next slide, you can go to the next slide. These issues, continuing to kind of look at community feedback, these issues were also present in the survey responses of residents. So nearly 5% of residents reported being unable to receive psychiatric or mental health services in the past year. The availability of providers was cited as a barrier to accessing care for approximately 8% of survey respondents. And then the lack of trust and the negative perception of quality of available care was also listed as a barrier. And just to note that this was for both primary and mental health behavioral providers. So just want to keep that in mind. Next slide. So just also considering the efforts and services that were previously provided by services provided to residents. So during fiscal year 25, the LBHA referred a total of 946 individuals to services, and approximately 83% directed toward mental health resources, demonstrating significant community need in this area. And as mentioned before by Imani and Sharice, the services that they've been able to provide in the county for residents has been necessary, even though obviously we need more resources, but definitely the effort that's been provided so far has been helpful. So additionally, the LBHA conducted 31 community engagement activities and behavioral health presentations to increase awareness and access to services. And they mentioned those again, and then I think Imani's going to put into the chat the two mental health events that are coming up in the future here. Looking at goal number 2 to improve provider and consumer awareness of available services and how to access them. As Imani mentioned previously, one of the roles of LBHA is planning, managing, and monitoring the public behavioral health system, which is a publicly funded behavioral health system. The map that you're looking at kind of outlines the number of providers in the area that are kind of that provide different types of treatment to residents, and that's kind of where they're located. So one of the things that I think in terms of being able to provide those the awareness and services, having more providers would be helpful, and this is our way to kind of track where they are in the county and the services that they can provide. So just to give you a little bit of information, the PBHS, which is a public behavioral health system, delivers services that are reimbursable via the Medicaid fee-for-service system. And currently, there are over 197 providers delivering over 600 services to residents in the county. One of the things that I want to kind of make note of is that the PBHS service utilization data, which would typically be included in the strategic plan, um, it hasn't been analyzed as yet. We haven't received that data. There was kind of a transition of services, so the ASO kind of transitioned into a different organization, which is Carillon, and so they have yet to provide us with the data. But once we get that, we'll provide that level of analysis as well to better understand kind of what services folks are utilizing in the county. Next slide. And just this is just kind of looking at the county utilizes data to assess the need for expansion of crisis services and to be able to respond to crisis in the county. And so the CRS, which is a crisis response system, data is collected from Behavioral Health Link, which is the platform utilized by the county to collect utilization data. And so this data presented here just kind of shows the number of cases by month that services were provided to residents in the county via that crisis response system. And it kind of allows the LBHA to monitor resident awareness. So as you can see, this is kind of month over month in the last fiscal year. And so it just kind of looks at the how many cases are being that are coming to the crisis response system month over month. You can see it kind of varies from month to month. Next slide, please. And this slide is the looking at the mobile crisis response team utilization. So when those teams are dispatched. So the mobile crisis response team, or MCRT, is kind of an expanded piece of that crisis response system, and just kind of allows to build the capacity for responding to crisis in the county. And so this is looking at the number of dispatches for that team month over month. And you can go to the next slide. And just looking again at goal number 3, to improve the quality and quantity of behavioral health services targeting youth and children. So the need for behavioral health services was already determined as a targeted population. I think Imani mentioned that. And so just looking at some data to support that. So between 2020 and 2024, approximately 9% of the total deaths due to suicide were among residents 15 to 24 years of age. And over 50% of these were among Black non-Hispanic residents, and nearly three-fourths of all suicide deaths for this age group were male. So, also according to the Youth Risk Behavioral Survey, over a quarter of high school students within the county reported feeling sad or hopeless, and that's almost every day for at least 2 weeks or more within the last year. So this percentage was higher for females compared to male students, and nearly 2% of Prince George's County high school students reported seriously considering attempting suicide in the last year, and this percentage was also higher for female students compared to male students. And we're noticing that we're also starting to see, the same kind of trend over the last several years just continue. And so this kind of, and this evidence just kind of allows us to kind of see the need for providing improved and also increased services to our children and youth in the county. Next slide. And again, this is just looking at the naloxone administration by age. Again, just kind of showing more further evidence for the need for addressing services for our youth and our children and our youth. So nearly 12% of naloxone administration was among 18 to 24, and nearly 20% for 25 to 34. Next slide, please. And this slide I kind of already talked about a little bit, was just looking at the percentage of students that have reported that they either considered, planned, or attempted suicide. Next slide, please. And then this is also previously mentioned in one of the first slides, was just demonstrating what that looks like among demographic groups, so male to female, and then the age breakdown as well. And I'm gonna hand it back over to Imani.
Imani.
Yeah.
Yeah.
Thank you, Deborah. Okay, and Shanae, I'm gonna just check in with you really quickly. I know we allotted 20 minutes for this lovely presentation, so I just want to check to see if we have space for questions. I know we plan to send out a survey so that we can capture any shared, personal responses from the group.
I can make space for 2 minutes for questions. That's okay.
Okay.
And anything else, if you want to drop your contact or the best contact in the chat for anyone who wants to follow up, that would be great.
Absolutely. Okay, and so here are our next steps. I won't read through all of them, but we have to submit right now, our strategic plan is in draft form. So that's an important part. It's in draft form, and we're working to finalize it through, any responses, shared any feedback from the Healthy Minds Advisory Group, as well as a letter of support from the Healthy Minds co-chairs. And we will submit that to our state representative agency, which is the Behavioral Health Administration, for approval. Next slide. Okay. And so we definitely thank everybody for your feedback and your participation in advance, your feedback in advance. I will open it up if there are any questions. We have 2 minutes. And I have contact information here to reach either myself, Ms. Cherie Smith, or you can also share an email with us directly, and we can connect you with Deborah Collier, who is our epidemiologist. Ms. Anya? Ms. Anya, you're on mute if you're speaking.
Good afternoon, everybody. Thank you so very much for your presentation. It was very informative. I have a quick question. When it comes to the opioid restitution funds, to what extent there'll be specific references to how those funds may be used? To what extent the work, I believe that the Prince George's County Workgroup that was tasked with providing recommendations on how those funds should be used in the county has wrapped up last summer, and we still haven't seen the final recommendations. So can you speak to what extent there might be an alignment between, once again, opioid restitution funds and this plan? Thank you.
Thank you, Anya, for that question. And we at the LBHA were a part of that work group. I definitely I was one of the members on the I want to say the main steering committee, but there were other members within the LBHA, our child and adolescent coordinator, as well as our manager for the public behavioral health unit, service coordination unit. We sat on that committee, and you're absolutely right. It wrapped with recommendations on priority areas and focuses of the opioid restitution fund. Currently, that oversight sits within the county executive's office at this point in time. But definitely, I think once a final report has been shared, I think we can certainly incorporate how, and of course, I know it will go towards supporting the resources, improving the resources in the county, and providing funding support. But I think once we have the final details on that, we can certainly incorporate that into our plan. And so I hope that answered your question a bit there.
Yes, I mean, yes, thank you so much. It's just that it has been such a long time. And I know, like, for me, I'm not privy. I have no idea what recommendations have been made. And I don't know to what extent, like, we may be missing out on some opportunities to capitalize on the funds that are already available. So, but thank you so very much. Appreciate it.
Yes, and once and what I can do is circle back to the special assistant for the Health and Human Services and Education uh, DCAO to see if there are any additional updates, that come out thus far.
Thank you so very much. And another question is, do you have plans to specifically work with PGCPS, since a lot of the issues, are affecting our younger folks?
Yep, another very good question. And so currently, the LBHA serves as the pilot hub for the consortium grant opportunity, which provides funding to service providers that are providing public behavioral health services and wraparound supports to Prince George's County Public Schools. And so we work closely with them to, ensure that quality services are being provided to students and families. Currently, there are 15 providers that have been selected under the consortium to provide services directly to Prince George's County Public Schools. And so from what I gather, things are going well. I see Mr. Larry Epp has his hand up. I'm sure you want to talk about that a little bit.
Oh no, I had another question for you, but go right ahead.
I put you
sorry.
on the spot.
Oh, can I ask my question? I'm sorry.
Oh, okay. I thought you wanted to reference the consortium.
Oh no, I
Okay.
say too much about the consortium, so let me be quiet then.
So I hope I answered your question, Anya, concerning our involvement with ensuring that there are quality public behavioral health services being provided to students. This is a new grant award for the LBHA, and we're working to become what's called a full community sports partnership hub. And under the community sports partnership hub, we would have fiduciary oversight of service providers. We would be the ones to develop the RFAs and issue awards directly to service providers. As a pilot hub, we're sort of getting our feet under ourselves right now, hiring two staff members who would support the work of the pilot hub, as well as developing our committees that would guide the work of the pilot hub. Okay. And then Mr. Epp, I saw your hand was up as well.
Oh yeah, I just wanted to ask you a question about another child topic. And I know a number of folks on this call were at that 1915I provider recruitment meeting, and just wondering your strategy about, building up those higher intensity services for high acuity youth. I have some, feelings about some of the challenges of the system. I mean, I feel the eligibility criteria for 1915I are a bit too high and get to kids a bit too late. And the issue of the rates that providers are paid, I think are still low. And I think that present some of the challenges that weren't, I mean, they unfortunately weren't addressed at the Carolyn recruitment meeting, but I just wondered if you had any, thinking along those lines, because I know it's an issue that kind of drives our emergency room boarding issues and our bed issues and our RTC issues. So I just wanted to bring that up. I'm sorry to be so, wordy about it, but
No. And you're perfectly fine. And I know we've been working to develop a presentation that we could share during our all provider meetings, and these are longstanding concerns that I know the state has, we have, and we actually have our child and adolescent coordinator in the meeting right now. And so Gina, I'm going to put you on the spot. Miss Gina Greenhood is our LBHA child and adolescent coordinator. Gina, is there any feedback or any updates you want to share concerning 1915I? And you're on mute, Gina.
Actually, we've had really a desert of lack of providers. I should say we have a lack of providers for the 1915I services. That's been one of our challenges here in the county. So that additional list of services that children and families are eligible for, like intensive in-home supports and experiential therapies and respite and those kinds of things, we've had a real issue with not having providers wanting to do those services. But Carolyn has now taken the lead in having some recruitment sessions with providers, and we had one today. So I guess the only thing I really could share is that we're working towards beefing things up so that our families can start getting this more intensive case management model. I'm not sure what else you wanted on Monty.
Yeah, no, I just wanted to hear the latest. I know you had the latest update on that. Thank you.
And
Yeah,
again,
I-
our role, Larry, as an
Yeah, sorry.
LBHA, even with Caroline taking that part over, is to make sure that we get the information out. So we definitely we do a great job with making sure the providers have the latest information that we have. And I know Shanae's like, we have to move on. Go ahead, Shanae.
Yeah.
I'm sorry. It was great discussion. I didn't want to
Yeah.
be disrespectful or cut time
No,
off. This is
no,
good
no, we're
information.
overtime.
Yeah.
But thank you all
May-
so much for being here. It really does mean a lot. And I think there's going to be some great opportunities for some overlap. I thought this was great for you all to come in so we could see what your strategic plan process looked like, because we're literally getting ready to get into the weeds of doing the same. So we invite you all back to be a part of that. And if you want to hang on for the next 15, 20 minutes, we're going to be going into our goals and objective statements and kind of making some decisions around there. So it'll be great to have your input considering your strategic plan, because we'll have some opportunities for alignment there. So thank you all so much. If you want to give just a virtual applause to our guest speakers, that would be fantastic. And AJ and I, we are going to run through some slides because we really want to get some feedback from you all. But yes, thank you again, everyone. We are getting ready to transition into the next phase of our CHIP development process. We've done a lot of collaborative brainstorming and decision making so far. So instead of going through those slides individually, I've just asked AJ to drop the problem statement, the data, our selected starting point, and the common themes that we developed last month's meeting. Just drop those in the slide for you all as a review. And with that, we are actually going to, if you remember, we started loosely drafting some goals. So we're going to share those goals and objective statements with you all today because we did some refining behind the scenes. We took your feedback, your suggestions, and we worked with our co-chairs to refine those goals and objectives to focus on our CHIP strategy development for the next couple of months. So with that, I kind of want to let you know that process. As I mentioned, we worked closely with our co-chairs, we try to get our goals and objective statements kind of smartish, right? So what we did, few important things to highlight. The intent of your ideas remained the same. Nothing was removed from the process. Instead, we grouped similar ideas together in some common categories to help us clarify some potential goals. And then those ideas were then structured and operationalized into some more actionable, measurable objectives. So ultimately, the goal here was simply to translate your brainstorming into a format that helps us prioritize, measure progress, and move towards implementation. So with that, AJ, I don't know if you want to go through each goal and objective separately, or if you just want to pull up the whiteboard and kind of talk through it, and then we can go right into our prioritization activity. Your choice.
I'll do the first option. I'll go brief. So starting with goal one. Thank you, Shanae. Again, as you said, right, everything here is still grounded in that previous brainstorming conversation. It's just we structured it with the assistance from the co-chairs into that more measurable, actionable format, right? So that we can use it for the chip. So starting with goal one, this is really coming from the group's discussion around behavioral health awareness, right? Reducing stigma and making sure people actually know where to go for services. So that shows up as increasing the percentage of residents who know where to access behavioral health services, as well as expanding mental health first aid training to support things, right, like early identification and connection to care. And so that's all on the slide there. And we'll make sure that this is shared out afterwards as well. We can go to goal two. Thank you. This builds essentially on what you all shared about culturally responsive care, language access, and making sure services feel accessible and appropriate for different communities. So you'll see that reflected in both increasing the availability of culturally and linguistically responsive services, and also making it easier for residents to understand what services exist and how to access them through centralized resource guide. And for goal three, this is where that essentially that coordination conversation, right? That's where this shows up. The group talked a lot about the need for stronger connections. It's another message. The stronger connections amongst providers, community partners, CHWs, right, as well as a better use of shared tools. So reflected here is going to be through promoting use of shared referral platform like Find Help or 211, along with establishing common metrics so we can better understand how coordination is actually working across the system. And for our fourth goal, this comes directly from the group's emphasis on strengthening the behavioral health workforce, right? So we talked about that earlier, and essentially increasing the pipeline of individuals entering the field. So this objective focuses on increasing that number of behavioral health workforce applicants serving the county. And then last but not least, we have our goal five. This reflects the conversation around employee mental health and the role that workplaces actually play in supporting that well-being. So this is where the idea of a healthy workplace standard comes in to help promote environments that better support behavioral health across employers. So I know that was very fast, where I'm working on a little bit of a crunch here, but these were all grounded essentially in what the group brought forward, right? We just wanted to structure them in a way for our chip. So what we do want to do is actually transition to our whiteboard and let you all vote on essentially the goal you would like to prioritize, what you may think is most feasible in the next 3 years, things like that. So I'll pull up whiteboard. And everyone here should have access to this. Does everyone have access? I see people popping in. Yes, perfect. So what we want you all to do, feel free to zoom in. You should have a zoom in option on your bottom right. So zoom in on the goals and the objectives so you can kind of get that refresher again. And then what we want you to do is on the right are a bunch of dots. You can actually grab one of those dots and you can place one of those dots on the right of one of the yellow Post-it notes. So we'll be tallying up our votes for what we're going to prioritize on the right of the Post-it note. So that white space next to the Post-it note, just put it right there on the right. Appreciate y'all.
I can't see anything. Is it because I'm on the web version?
I'm not sure.
How about this? See if you can do something. Put this link in the chat.
And actually, I do want to clarify while AJ's working on that, everybody gets 2 dots. So you can essentially, if you feel very strongly about one goal, you can place both of your votes on that one goal, or you can place 1 dot on one goal and your second dot on another. So everybody gets 2 votes. Honor system here.
It's making me sign into some kind of account. Prince George's County, Maryland, sign in.
Is it possible not to cover the goal? Goal number 2 is covered by Claire. If she could move it a little bit. I can't read what that is.
Yes, just a reminder to place your dots on the white space next to the goal, to the right of the goal, not on the Post-its.
Thanks, Claire.
No problem.
And Dr. Blount, I can send these goals and objectives to you separately. And then if you want to share your feedback to me, I can consider that.
Thank you so much.
Sure.
You know I'm invested. I want my vote counted.
I know. If anyone else has any issues, just let me know. I can do the same.
Maybe give it a few more minutes. Want to give. We got about 20 people in here. Want to give everyone a chance to
And
get
I'm
at least
sorry,
one vote in.
Sorry, a quick
Oh, yeah, go ahead.
question. Is there anything that actually talks to increasing the number of service providers? Because it's how to say,
That'll be goal 4 and objective 4.1.
got you. All right, thanks.
If you're not 100% comfortable with the language, that's fine. We'll have an opportunity to really do some more refinement at our next meeting. So right now it's just kind of getting those general initial thoughts, those first thoughts.
So quick recap. Goal number 1, we have increased behavior health, literacy and navigation. Goal number 2, we have increased access to culturally responsive behavioral health services. Goal number 3, we have improved coordinated behavioral health care and cross-sector collaboration. Oh, saw a note get moved there. Let me move that up real quick. There we go. Goal number 4, we have strengthened the behavioral health workforce. And then goal number 5, promote healthy workplace practices. Everybody about 2 minutes here, 4:05, we can close the the meeting voting, but we'll have some. Yeah, there you go for Dr. Blount. Perfect. Yep.
Okay, thank you. I'll check now.
Absolutely.
And we have two, we only vote on two, yeah?
You get 2 dots. Yep. Or I guess in your case, you 2 votes.
2 votes. So you can place both on one, or you can place one on one and one on the other. Everybody gets 2 votes.
One more minute left for voting here. Seems like we have a strong case for goal number 1, increase behavior health, literacy, and navigation. I see a lot for goal number 3 as well, improve coordinated behavior health care and cross-sector collaboration. And we have a tie between increase access to culturally responsive behavior health services and strengthen the behavior health workforce.
AJ, make sure you vote too. You count.
Oh no, I did.
Oh,
I did.
okay.
The PDF file is protected.
Oh gosh, I'll get it to you. I'll type them out
But
and
it's
send
okay.
them to you.
Okay, no problem.
That is too funny.
Yeah, y'all real secure around here. That's good.
Here, I'll put them in the chat real quick as well. Should have started with that. So. Drop them in the chat. Put the grouping together. There we go. All right. 406, 1, 2, 3, 4, 9, 10. No. All right. And we can give Dr. Blount, what do you think, Shanae? Give
You
after
can,
the meeting?
yeah, Dr.
Well,
Blount, if you
Okay,
want.
okay.
give me like 30 seconds. I'm
Oh,
almost
okay.
in the
30
public.
seconds for Dr. Blount and any last minute votes. Thank you all for participating in this.
Absolutely. Four and 5, got it. I'll put the dot 4 and 5. Okay.
Good to go?
Yes, we are. Turn it back over to you.
Okay. Great. Thank you, everybody, for leaning in on this process. I know it was a little abbreviated, but we appreciate you taking the time to be with us today and to participate in this. Again, we know the language isn't finalized yet. We still have to figure out some baseline numbers, some dates, things of that nature. But we'll have the opportunity to refine that at the next meeting, as well as begin strategy development. So really, really exciting work. Thank you again to our presenters who came. And in the meantime, in between time, consider the strategic plan that the local behavioral health authority shared with us today. Maybe there are some other action plans out there that we should be considering. Again, we talk about how there's a lot of overlap in what we do and how we don't want to recreate the wheel. We really just want to enhance or help expand what already exists, and find ways to improve it, right? So that way our residents can have greater access to the services and resources that exist in our county. So bring those to the table next month, because we're gonna be looking to you all as the experts and our knowledge sources on what's available and how we can really address the problem statement, considering the goals and objectives that we want to use to focus on. So with that, we have about 6 minutes. We have a few community announcements to share, and I think we can run through those pretty quickly. AJ, do you want to do that, or you want me to run through them?
I can run through them.
Okay.
Sorry, pull you back up. Okay. So starting off with First I and Me is going to be hosting a 10-week grief support group for Black men coping with grief. This group will be led by grief clinicians and will meet on Wednesdays from March 18th today through May 20th from 7 to 8:30 p.m. If interested, you can visit iandme.com to schedule a free consultation. Another opportunity to highlight is Dine, Learn, and Move for Prince George County partners are hosting monthly virtual sessions focused on staying active and making healthy choices. This month's topic is Plant-Based Made Easy, taking place Wednesday, March 28th from 6 to 7:30 p.m. Registration information is on the slide and will be shared after the meeting. We also want to share an upcoming Bridge Center open house hosted in partnership with the Prince George's County Health Department. This event is designed specifically for returning citizens, their families, and service providers, and will focus on available resources and support through the Bridge Center. Attendees can expect lunch, refreshments, and giveaways, along with opportunities to connect with services. Another event to lift up is Prince George's Mental Health Champions. They're going to be hosting Come Out and Play. It's going to be a free ice skating event for all ages at the Bowie Ice Arena. This will take place Friday, May 1st from 6 to 8 p.m. You can find more information by using the email on the slide or the QR code listed as well. We also want to highlight the GOAT, G-O-A-T, Youth Mental Health Expo taking place Saturday, May 2nd at Bowie State University. This is a free event for youth ages 16 to 25 and their families, featuring workshops, resources, live performances, and connections to support services. Registration is available through the link on the slide. Another great event coming up is Spring into Wellness, hosted by Prince George's County's Mental Health Champions. This Behavioral Health Expo will take place Saturday, May 16th at the Southern Regional Technology and Recreational Complex. This is a free interactive event for all ages featuring a farmer's market, food demonstrations, fitness activities, health screenings, and educational resources. And lastly, we want to share Brain Health for Every Generation, hosted by the Alzheimer's Association in partnership with Parks and Recreation. This event will take place Saturday, May 23rd from 1 to 3 p.m. and will be offered both in person and virtually. It will focus on practical ways to reduce risk and build resilience across the lifespan while also creating space for community discussion and shared learning. Registration details are available on the slide. And then we got a little bit of time for partner announcements.
I can give a minute. Any additional partner announcements? You can add them in the chat or email them to me to be included in the email follow-up after the meeting. But we can open the floor right now.
Hi there. My name is Bilquis. I'm with the Behavioral Health Division under the Adult Linkages to Care program. So we are actually hosting an open house at Bridge Center. So I was going to just drop that flyer in the chat. So that is next week. We work with a lot of programs in regards to reentry. So I'll just drop that in the chat if I can find it. Give me one moment.
Sure. Thank you.
Of course, thank you guys. And then we do, it is next Friday. And Dr. Wiggums, if I'm missing anything, please let me know.
Great. Any other announcements?
Yes. Hi, everyone. My name is Jamie Menendez. I am a regional education coordinator with with a nonprofit called EveryMind. We're a mental health nonprofit. And for those of you who voted to have more educational resources for the community, our organization actually offers free youth mental health first aid trainings happening online. And we also have a QPR, which is a suicide prevention training, free for the Prince George's County community. So please, if you'd like to attend, if you're interested in any of these trainings, I have the registration sent to the chat at this moment. But yeah, feel free to join us. And in the case you would love to see, hi Cherise, and in the case you're interested in more education on mental health. And this is open to anybody in Prince George's County, so feel free to join.
Awesome. Thanks, Jamie. Good to see you.
It's good to see everyone too.
I think we have Anya.
Yes, thank you so very much. Thank you for including the last flyer on the brain health event on, I believe, what is it, May 23rd. We had a presentation to Prince George's County Council from Alzheimer's Association, which is actually working to putting that event together. And I wanted to let you guys know that actually out of all counties in the nation that was surveyed by the association, we rank number 4 in the whole nation, right, when it comes to dementia-related diseases. And I also wanted to let you know that one of priorities for the current council chair, Madam Crystal Oriada, is early identification and screening for autism. So while the plans are still pending, still in the works, but we do expect to have several autism related events in Autism Awareness Month, which is April, coming up. So thank you.
Thank you, Anya. And last announcement, Carrie?
Yes, hi. My name is Carrie Stansel. I'm from Hospice of the Chesapeake, and we are hosting our yearly child grief camp. It's called Camp Nobby. It's going to be held from August 7th to the 9th, and while that feels really far away right now, we try and get kids ages 6 to 18 to participate. There's $100 registration fee, but we also have scholarships available for those who can't afford that. And because we are Hospice of the Chesapeake, you don't have to have any grief related to hospice. You can have any sort of grief as a young person. And it's a wonderful camp experience where kids get to learn how to cope with their grief and be around others who have experienced similar losses, like a parent that has passed in an accident or gun violence and things like that. And it's really a transformative experience. So I'll drop the flyer in the chat, I guess. And if you have any questions, please feel free to reach out. We'd love to have any kids from Prince George's County. Thank you.
Thank you, Carrie. And I'll be sure to include that in the follow-up as well. I didn't forget about you. And I know we're a minute over, so to respect everyone's time, next month's meeting, same time, same place, Wednesday, April 15th. We'll be continuing our strategic planning process, working on specific strategies for the goals and objectives. And with that, thank you as always for everything, for all your insight, for your expertise. We truly value your time and for you all being here with us through this process. And we look forward to continuing this work together. So have a great day, and thank you for just hanging in there with us for that extra minute. Have a great afternoon, everyone.
Thank you.
Thank you.
Thank
You too.
you.